Hey, what if there was a five-step system where you could get 100%? Hey, look, I'm not kidding. 100% of all new patients to minimally agree on day one that chiropractic is healthcare lifestyle, not only for families, but even more personally for their family. Now, that may seem impossible. You can say, Fred, you're crazy. But when you go to the day one, day two boot camp, here we go. Hashtag Mindset Masters, June 6th through the 8th in Atlanta. I'm going to show you exactly how to do this. Now, there's 5 steps. And I'm going to cover these 5 steps right now, very briefly. Step one, they have to get the principle. What's that mean? Spine and nervous system is the foundation of life and health in the body. Why is it the foundation? Because it's energy through the spinal cord. It's the principle. And here's the one-liner. Spinal cord is your lifeline. That means it takes energy to all the organs to, one, keep you alive. That's pretty important. Two, to keep you healthy. Now, the amount of energy is going to determine whether you're in the state of health or the state of disease. We're going to show you how to do that right in the pre-consultation. And then we're going to show you what's the next step, what they didn't know, what their other healthcare providers didn't tell them, what their pain-based chiropractors didn't tell them. Hey, when you got a back injury, man, it shuts down the energy, subluxation, dimmer switch wall can lead to disease. That's all the ulcerative colitis, it's the asthma, it's the blood pressure, all that. Now, all of that we have proven in a book, Back to Health. Go to Elite Coaching LLC, get your free digital copy. That's the medical studies that support all of that. But what didn't their other doctors, their MDs, and their chiropractors tell them? That when you have a subluxation, dimmer switch wall shuts your energy down, it's going to break down your health. That is the foundation of health. What's step three? So once they get the principle, once they get what they weren't told, then they're like, hey, I can see on that chart all the nerves are connected to all the organs. That's what makes my body work. So if that's shutting down the energy, and I've suffered with asthma, so what do you say in the consultation? Hey, did your doctor, when he gave you the inhaler, did he ever ask about traumas? Did he know you got in a car accident 3 years earlier, and then 3 years after that you develop asthma? Did he tell you that the lower neck and upper back are nerves to the lungs, and that tends to be correlated with asthma? Did they go through that? No, they didn't. So what's the third step? So one, it's the principle. Two, what they weren't told. Three, now here we go into three. Three is, how do you want to live? How do you want to live your life, rest of your life? So now that you know that, now that you're subluxated, now that you have 16 health problems, now that you see the progression of subluxation, how do you want to live the rest of your life? And what's that mean? So really, it's how do you want to live? Because what did we do? We changed their belief system. We changed beliefs. If you want someone to live a lifestyle, you got to change their beliefs. So what's step three? How do you want to live the rest of your life? So now that you know that, what do you want your health to be like? How do you want to live the next 50 years? What do you want your health to be like? That's step three. And then we go to step four. Time and money are not an option. So we set a vision for their life. And we say, what are your 20 to 30 year health and life goals? What are your values? What's most important to you? Here's number one. What's your purpose? And once we get that, now we say there's generational patterns. Now that we see the generational patterns, now we have a purpose. Now we know the life that we want to live. Now these health conditions are passing through generations. And now you see, you got it from your mom, you got it from your uncle. You have the same pattern. You're giving it to your kids. Your kids are going to give it to those kids. If we don't stop that pattern right now. And it's not just health pattern, it's a subluxation pattern that leads to health pattern. And once we get that, so where are we? One, step one, principle. Step two, what you weren't told. Step three, how do you want to live the rest of your life? Step four, you have all these goals. What's your purpose in life? And it's and then step five, generational pattern. Now, referrals become automatic. How easy is that? Man, when you do this like a system, family referrals become obvious. They ask you to bring their family in. Extended family becomes automatic. Now you're not getting just one patient. You're not trying to create a patient. You have the purpose of breaking a generational pattern, and you get 3 and 5 new patients that are already qualified. Do you want to do it the hard way? Educating, talking, trying to close one person? Or do you want to break generational patterns that live chiropractic lifestyle beyond your lifetime? If you want to do that, book a generational breakthrough call, generational legacy breakthrough call. Let's talk. Let's see what your goals are. Let's see what your visions are. Let's see what your challenges are. And if we can connect and we have the same purpose and you want to follow a system that's already proven, then there it is. Hey, you become the lighthouse, right? You bring heaven to earth. Your message goes out into the world, clears the clouds, and brings heaven to earth. Thy will be done on earth as it is in heaven. So June 6th through the 8th, Atlanta, check it out. Book a generational breakthrough call. Let's connect and let's make a bigger difference on chiropractic healthcare than we ever have before. All right, love you guys. Peace.